Well, hi everybody, this is Dr. Schroeder with this week's video introduction to week number 6 of our class in evidence-based practice. And once again, another good week of discussion. Fairly straightforward this week. The reading and the course materials dealt with the various models of ways to evaluate evidence-based practice implementation, and you reviewed the various models such as the Johns Hopkins model or the Iowa model, the STAR model. And you see that, and as the discussion revealed in class, is that each one of these models has specific strengths and weaknesses or specific types of evidence-based practice where they would apply, and others where they may be a little bit too general or not specific enough. So in the real world of evidence-based practice, though, most organizations tend to gravitate towards one of these models or another, depending on whether the hospital is a research organization or whether it's a larger healthcare organization. That is going to drive some of the decisions. Probably the most common one that is used, at least in my experience, has been the Johns Hopkins model, and the PET model is that part of that Johns Hopkins where you talk about or where the model discusses the transition process and how you transition from current practice to new practice. And that's really the idea here. The idea is that we're understanding that there's a lot of change that's going to be happening, and a lot of change that surrounds any new evidence-based practice implementation, any new practice-based policy. And so really thinking towards the implementation is important. And so that really brings us to week 6 and what we're going to be discussing in week 6. Two big things due this week. Of course, your evidence-based practice paper part 2 is due. And your discussion question this week is designed to help you with that a little bit. The discussion question this week focuses on what are some of the barriers that you would see towards implementation of practice. And again, I want to reiterate, we're not talking about nursing research here. We're talking about you're coming up with a new practice that you're going to be teaching staff how to do, teaching them how to uh, provide some new form of practice. And many of them have been doing the same practice for years, and many of them learned in nursing school that it's the actual totally best way of doing things. And so you come along with this new research that says it's the best. Well, who says it's the best? And well, maybe it's not the best. And so you get a lot of these rumblings within staff. And within the staff ranks, causes a lot of resistance. Also, you get resistance from administrators because part of what you're going to be doing in your evidence-based practice part 2 project is projecting how much is it going to cost to do this thing. How many dollars is it going to cost? Is it going to be something that the organization can manage? And so a lot of times you have to do a lot of selling and sometimes some tweaking and compromising over what those costs are going to be. And so this is all things that need to be taken into account, and it's going to be what we're going to be talking this week in the discussion class. And of course, you're going to be addressing that as well in your evidence-based practice papers. The thing that I would encourage you to be most specific on in your papers is the two matrices. One is where you're going to be developing a plan for implementation. And again, this is a plan for getting staff trained, for getting the equipment, for making sure that everything is ready to go before you implement the practice. That's what the first matrix is asking you to do. And then the second matrix is your evaluation plan. That is, how are you going to evaluate that the new practice was fully implemented. That's where you're going to be going back and reviewing your outcomes. That's where the time frame is important in your PICO. And actually stating, here's what we're going to do. Specifically, here's what we're going to do to go and measure our data. If we said that patients are going to, we're going to have an increase of patient satisfaction, then this is where you indicate either your HCAP scores, your Press-Ganey scores, the questionnaire that you're going to use. What are the scores that you expect to see? In the implementation plan, you're going to identify actually implementing the practice, you're going to identify, for example, what that questionnaire or what that mechanism is going to be, and that you're going to be, training all staff, and that all staff are going to be trained by a certain date, and it's going to take a certain amount of time to do all that. So that's what those two matrices are. So it sometimes cause some confusion, and so kind of in a nutshell, that's what they refer to. And as you have questions, please post them in the class. I'll be more than happy to answer them. Also, as you do have questions, I would encourage you to post them in class. It's easier for me to give one response to the entire class than 8 different individual responses to everybody else if the questions are pretty much the same. So that's pretty much it. We're kind of sort of gliding into the last part of the class. We're into the last 3/4 of the class, just a couple weeks to go after this week. So I look forward to participating in class with you. If you have any questions, please feel free to post them, and we'll see you in the discussion forums, I should say.